for that. I'm a guest, Dr. Faith B. Israel. She's a doctor too. I guess you guys are hearing us now.
What about
Just you
now?
can put a yes in the chat box. I guess you guys are hearing us now. I'm sure you're hearing us now. You can let us know if you're hearing us. You should be hearing us now. Good night to all those who are on the program. Good night to everybody. Good night. Good night. Are you hearing us? Please put a yes in the chat box or a no. We are looking for your response. The signal here is showing that the um the signal is going out. Okay, I think
Okay.
they are hearing us now, Doc. So why not let's just make a recap of what we talked about early on. And by the way, I want to welcome those who are on the program. I'm seeing Dr. Faith B. Israel on the program. We like to welcome you officially to this broadcast. June Foster, Janice Baxter Lewis, of course, my daughter is watching. Tiffany Lewis, Donna Mae Walcott, and there are others on the back end who are not seeing the names as yet, but we are very happy to have you on. Doc, why not make a recap of what you talked about early on?
Yes, guys, come on in. Come on in. You know what? I was saying I was just so excited for this topic because there's no more fitting time than now for us to really be discussing this topic of women's health. You know, we're gonna be discussing three topics tonight, which are really interesting and charged at the same time. Um, but because this is March, and this is also Women's Month, Women's History Month, Women's Health Month. That's why I said this is a great time that we chose to really focus and highlight women's health this month. So I really want to thank you for that. And Baxter, that was your idea, so I cannot take the credit for that, you know. And I think it was great. So thanks for really featuring us tonight.
You're
Don't
welcome. You're
worry,
welcome.
we're gonna get to the men.
That's right.
Men
That's right. That's
Month
right.
is coming up in June.
Mm,
Men's Health Month is June, so we did not forget about you. But tonight it's about us, so
about the
we're ready.
ladies.
Yes,
And
it's about
it happened to us. A guy is doing the interview, the host.
that. Well,
Yeah.
that's how it should be.
Yeah.
That's
Right.
how it
Okay.
should be.
Okay.
So, I was saying, you want us to really just talk about mental health uh, just for a little bit as we get started. And anyone that has heard me speak before or just knows about my philosophy towards health and wellness, I really like to approach the topic of health with an all rounded view, a holistic view. That's the word I like to use. And so when we talk about health in the holistic view of looking at things, we have to talk about mental health, how we, deal with our emotions, how we handle stress, obstacles, challenges in our lives. And it's a big thing. It really is a big thing. And I like the idea of us just having the conversation because it's not so easy to have the conversation. It really isn't, but it's affecting all of us, men, women. We're featuring the women tonight, so it affects women, it affects our kids, it affects families. And oftentimes women, we have that nurturing role to play in the family. And if we are not good, sometimes the rest of the family is not going to be good. We're part of that unit. And so, it being Women's Month, Women's Health Month, Women's History Month, I think is really time for us to take up that mantle and say, how are we doing emotionally?
You know, Doc.
And not sweep things under the rug like we like to do sometimes,
Y-
but check in with your sisters, check in with your aunts, check in with the female members of the family, and just say, hey, what's up? How are you doing? How's your day today?
You know, Doc, a question came to mind while you, this was not on script, but a question came to mind while you were talking about mental health there. You know, one of the things that we'll be discussing tonight is breast cancer. And I think this would throw us right into this discussion. When women suffer from breast cancer, of course, you see this all the time. How does it affect all of them, or if not most of them, mentally?
Well, I think it's going to be different for different women,
Mm-hmm.
because just with anything, you can't, not everything fits in a box and
Mm-hmm.
you can wrap it up neatly and tightly and put that nice bow on it. So every woman is going to handle it differently. But I think the important thing is giving us the space. First, we need to understand why this is an issue for us, particularly Black women, women of color. The statistics are really crazy, and we're really trying to figure out why we're seeing what we're seeing. So when it comes to Black women, for example, um, although we are the incidence, right? So although the incidence of breast cancer is not as high for us, like say if you take white women will get diagnosed with cancer more frequently, right? So the incidence is higher for white women. But the problem, where the conundrum comes, is that Black women, although we're not diagnosed as much, when we are diagnosed much later, right? In the stages, and the cancers are usually much more aggressive, and therefore our death rate is high,
Why
or
much?
our survival rate is low.
Why much later? Is there a specific reason why black women are diagnosed much later than white women?
So this is a loaded topic as well, and we have to talk about the concept of health disparities,
Mm-hmm.
or this inequality that we're seeing. And it's a multifactorial thing. It's not just one thing.
Okay.
Some of it is traditionally, our culture, we tend to, traditionally and historically, we tend to have not the best relationship with the traditional medical community, right? If you go back to history,
Mm-hmm.
right?
Mm-hmm.
Um, and I don't know, I think it's too much for us to even get into that, but there's so many reasons back in history where that mistrust of
Mm-hmm.
the traditional wider medical community has developed. So we're not so trusting of medical providers, right? And so we don't want to go to the doctor, where we might be afraid to go to the doctor. We don't want to deal with the bad news that we might potentially get.
Mm-hmm.
So fear is a big thing, mistrust. Sometimes it could be that we're so busy. Again, women are wearing so many different hats, and we forget the routine screening that's supposed to be taking place on a yearly basis when we reach a certain age. So we begin to just slack up on those things, that our screening. And of course, mammograms is a big part of it. Some of it is health insurance.
Mm-hmm.
You know, people might not have, or feel they might not have, insurance that will cover the screening test.
There's a com-
And of course, in the United States, we have to deal with immigration, where sometimes people are afraid to go to the doctor if they are undocumented, and feel like that is a way to capture undocumented individuals, and they
Mm-hmm.
think that there's a risk for deportation. And then, if that wasn't enough, it just boils down to the systemic racism that is inherent in the medical community, particularly in the United States. There's an inherent racism that just exists across the board
Okay.
that we have to deal with.
Doname Walker is saying here in regards to the question, society and economic factors. What do you think?
Right. So that's why I was talking
Mm-hmm.
about the economic factors, which has to do with insurance, the societal factors that has to do with the systemic racism, and also stress too is a big part of it. Just the idea of being a black person, but this is women's. This is we're talking about the women tonight. So
Mm-hmm.
being a black woman, um, it comes with a whole host of issues that, you know, people of other races do not have to deal with. You know, I was my goddaughter actually is now in college, and she's pre-med. Yay for her. I'm so happy she's going to be a doctor. But she called me a couple of weeks back, and she had an assignment for her class, and she asked me questions about my experience becoming a black female doctor
Mm-hmm.
in the United States, and what was my experience, and did I experience racism or genderism. And so the funny part is that as I was answering these questions, she was very surprised by my answers. Number one, because she had no idea that I had experienced all these things, and I kind of was just saying it nonchalant, you know, like, oh, have you experienced? Do you experience racism? You know, how often do you experience? I was like, oh, every day. She's like, what? Every day? I'm like, no, no, it's a daily thing. But I said it so nonchalant, and so as she was, you know, interviewing me and asking these questions, I just began to realize all the things, all the areas where those kind of situations arise in my life, and it really is a daily thing on so many different levels, in with so many different people that I deal with. But I don't know. I think I'm so used to it
Mm-hmm.
that we just deal with it, you know, and you don't make it a big deal. It's like, okay, well, this is another thing that I have to deal with, and I have so many other things to do, so I need to just check that off and get to the next. I can't really think about this now. I can't really process this now. But speaking to her, it gave me, I was processing a lot, and I was like, yeah, that kind of is a lot. I was saying it like it was nothing. She perceived it like it was a big deal, and that her reaction to it made me realize, yes, this is a thing. And how am I so okay with it? For,
Okay.
for lack of a better term. So there's so many, and I think if women think about, if each one of us think about our lives and all of the different decisions we have to make on a daily basis, and all of the different things that we're faced with, whether it be racism, genderism, classism, all the isms, just name all the isms that we go through on a daily basis, and we just rip and run, and we just take care of it and on to the next. We have to realize that that has to affect us whether or not we are realizing it or processing it.
Doc,
And we
I have a
talk about
question for you.
stress.
I have a question
Hmm.
for you. Um, how would you advise? Okay, you talk about black women and white women, right? How would you advise a black woman coming to you, knowing that she has breast cancer, she do not have insurance and things like that? What normally would you tell them?
Well, first, I guess we would, before we go there, the diagnosis of breast cancer, maybe we talk about the screening guidelines quickly, just in case there's
Mm-hmm.
someone out there who hasn't been screened for breast cancer yet and wondering, hey, or maybe hasn't been screened in a long time. When was my last mammogram again? Am I due for a mammogram? Should
Remember
I
we talk
get
about
it?
self-care, right?
Mm-hmm.
Mm-hmm.
That's a big part of it, getting your screenings done. So the guidelines might be different based on your personal risk factor. So it definitely is important to have a conversation with your physician about whether or not it's time for your screening for breast cancer. And while you're at it, talk about all the other screenings. Is it time for your colonoscopy? Have you been to the dentist this year? Do you need a DEXA scan to look at your bone health? Just basic things, because there's like a lot of different screening tests that need to be taken. And because we're so busy, you might just forget. Oh my gosh, I haven't had a mammogram in 3 years. What? Really? It just seemed like yesterday. I'm sure we have all these moments. So the recommendation is age. Take this with a grain of salt, right? So age 50 to 74, average risk. That's when women should start getting mammograms, age 50 to 74. That's average risk. So when we say average risk, we mean things like no family history of breast cancer, no history of radiation to the chest before age 30. But again, we're talking about Black women. So again, keeping in mind what I mentioned before about the stats for us in terms of us being diagnosed a lot later and more aggressive stages of disease, and our increased death rate.
Mm-hmm.
So the rule of thumb, or the common knowledge, is that we would get screened earlier. So we would start screening at age 40 to 45. So if you are a woman of color and you are between the ages of 40 and 45, and you have not had a mammogram yet, it is definitely important for you to go and get that. Or if you haven't had, if it's been more than a year and you haven't had your mammogram, then it's time to go and get one.
So,
So where do you go to get one? So it depends where you are. Like, I'm in New York, so I can give a lot of resources for people in New York. I know we have people listening from all over, a lot of different countries, all over the Caribbean, a lot of different states. So it might be different in your state. But a lot of places have, because we know this is an issue for us and we're really trying to make dents in these disparities and decrease all of the negative things that we're seeing, the late diagnosis, the aggressive cancers, and really try to keep our women alive. A lot of places have mobile vans or places where you can get screens for free, even if you don't have health insurance. I know that's very common in New York, where I am, and even in New York, if you don't have health insurance, there's many options for low cost, free health insurance, and the mammograms would be covered.
Doc,
So if you're in New York and you're not sure, reach out to, you could just, it's as easy as calling 311. If you're in New York, you don't know, 311. They will direct you and get you on to where you need to be.
Doc, we out there in North America, the women out there in North America, they are at an advantage to the women in the third world countries like these, right? Because of course you know very well you can get a mammogram so fast in the United States or Canada, England, but down here in the Caribbean, it's different. Because I've heard women talking about how long they have to stay to get things done. They do not have insurance, because insurance down here, private insurance down here is pretty expensive,
Right.
and they have to stay a long time before they can get a test. Is there any other advice you can share with those women?
Well, a couple things I would say. So if we notice that there's a lack, or there's a need, and if women in the Caribbean cannot, if you're in an area in the Caribbean where you cannot get access to mammograms, that's probably something where we would now have to band together and see what is the barrier, right? And really try to change things at the policy level. Now, obviously, that doesn't happen overnight. There's politics involved there, but I'm really sure that if women get together and really talk about these needs, eventually things would change, right? So that's something to really try to change it on a policy level. Go to the leaders who are involved with the availability of these things, and see what can be done, right? But that takes a concerted effort, and it takes leadership involved, and it takes cooperation, and it takes time.
Mm-hmm.
The other way that what women can do when we talk about self-care, right? And we talk about the risks for cancer development. This is where self-care comes in. So we know that there are certain activities that can decrease your risk for cancer in general, even if you have a family history, depending on the type of family history. Obviously, if there's a high genetic potential, for example, if you have the BRCA genes mutations, for example, that will really increase your risk for breast cancer. And so if you're out there and you have a family of breast cancer, it really is important that you get screens, and also get screens for certain mutations. But there are things that we can do on our own as women to take care of ourselves, to try to decrease the risk for cancer development. And it's the same activities that you would be involved in to stay healthy in general,
Mm-hmm.
right? When we talk about self care, it's funny because what I notice is that if we're talking about high blood pressure, if we're talking about diabetes, if we're talking about stress management, we're talking about cancer right now, we're going to be talking about menopause and
Mental
mental health
health.
a little bit more. It's the same activities that we need to be involved in that can give us a fighting chance. So, first is how we manage our stress. Second is hydration, making sure that we are staying hydrated with clean, filtered water, drinking enough water every day. Sleep is very important. Adequate sleep, because it allows the reactions to take place in the body. There's certain reactions in the body that must take place for us to be healthy, that only take place when we're sleeping.
Sleeping.
Certain regeneration of cells, it's like cleaning house. The dead
Mm-hmm.
cells, dysfunctional cells are being killed off, and then the new ones are growing and developing. And it's really certain reactions that only take place when we are at rest, when we're sleeping. So sleep is important.
Is it?
Our
Is it?
nutrition.
Doc, stick a point. Stick a pin. Is it true that most of these activities would take place after 10 or before 10 in the night?
So it really is. So it depends on that number. So it wouldn't be before 10. But the average time that people sleep is usually, we know that adults need anywhere from 7 to 9 hours of sleep. And of course, if you're sleeping at night when the body's meant to rest, that's different than, people who work nights and sleep during the day, because it has to do with the circadian rhythm. And when your circadian rhythm is off, then a lot of things become off as well. So I would say roughly getting 7 to 9 hours of sleep. So if you go to bed at 10 or latest 11, right? So 7 to 9 hours from there. But what is key is also the different stages of sleep as well, because there's different stages of sleep, and a lot of these reactions take place during deep sleep or REM sleep, not like the beginning stages.
Mm-hmm.
So that also is important. Is the amount of hours, but also making sure that you're progressing through the different stages of sleep as well. So that gets to the quality of sleep. And in order to make sure that your quality of sleep is the best it can be, you have to have a routine, right? There's a certain routine, and that has to come into play. And everybody might have a different routine, but it would be things like, not having large meals right before bed,
Yep.
no caffeine or alcohol right before bed, cutting off the screen time before bed, setting the mood for your bedroom, you know, making sure that you're only doing certain things in the bed,
Mm-hmm.
right? So sleeping or sex, right? That's
Mm-hmm.
it. Nothing else.
Nothing
Nothing
else.
else in that bed.
Just
No,
those two
you're
things.
not doing work. You're not catching up on work. You're not,
Yeah, yeah.
so you have to have a routine, but sleep is also important. Our nutrition is key. So, you know, cutting out processed foods as much as possible, refined sugars, refined carbohydrates, limiting that, making sure that your diet is as clean as possible. You're consuming more whole foods and mainly plants, like making sure you're getting the greens in because of the and the dark colored vegetables and fruits because of the antioxidants.
Mm-hmm.
And we know antioxidants are very important for cell
So yeah.
development, cell growth, and making sure, because the issue with cancer, no matter where it is, yes, we're talking about breast cancer, but breast cancer just gets the name because of where the
Where
cancer
it is.
where it first attacks, right? Because we know it could spread and then it goes elsewhere. But where it started in the breast, so that's where most cancers get their name. But the underlying issue of cancer is one of two things happening, right? So you have abnormal cell growth. Either a cell is growing uncontrollably too much, or it's not dying, right? One of those two things, or sometimes it's a combination of the two. So we're getting to the issue of healthy cell development, and you need proper nutrition, and antioxidants really play a huge role there. So your nutrition is going to be key,
Mm-hmm.
but also exercise is also key. So there's an increased risk for breast cancer for women who are carrying around extra pounds, right? So we have to manage our weight.
Doc, I have a question. In regards to exercise, is there any form of exercise that women should really practice to help avoid any form of exercise at all? Or just walking, running, jogging?
Yeah, I think at this point, especially for someone who's starting out and not really sure what kind of activity to get involved in, how long. First of all, before you start any exercise program, you definitely want
Check
to
a
be
doctor.
cleared
Hmm.
by your physician, because if you've had recent injuries, you don't want to re-injure yourself, or so there's
Hmm.
certain things you definitely need to be cleared for activity. And then you want to find something that you like, that you could see yourself doing on a regular basis, and it's not so much of a chore all the time, right? And you have to know the kind of person you are and what you like. So for some people, dancing is dancing. Some people, it might be yoga, which is a combination of stretching and breathing, right? That's how I see yoga. But that calming, it's also calming, but it's stretching and a lot of the different poses there. That may be easy for somebody to start off with. And you might be the person that you don't like walking.
Mm-hmm.
You don't like jogging, but you know how I'm sitting in a chair right now. There's so many exercises that you can do in your chair that you could get the same amount of workout as somebody running an hour on the treadmill. So you have to see what you like, and sometimes you have to vary it up a little bit. When things get bored, if you notice you get bored, or do you like to exercise to music? Do you certain kind of music you love? I know for me, when I'm exercising, I have to have soca music
Mm-hmm.
or hip hop, like rap and upbeat R&B, old
You get
school
all your
rap.
moves with that.
Have to get all my moves in. It cannot be. I cannot exercise to gospel music. It's not happening.
Okay.
I just,
Good, good, good.
no. I
Um,
mean, so it depends. It's what you like, and then you want to do it most days of the week. So that's at least 4 days a week
mhm.
for 45 minutes each time. If you're
Right.
not there, but you might not be there. So maybe you have to start with 2 days a week. You start out with 10 minutes each time and
Okay.
you work your.
Now I'm tying in two questions here, right? Tiffany is talking about fruits, right? Yeah, fruits and so on. And also I want to tie in another question so you can relate to both questions in regards to radiation. Because many a times radiation are introduced by doctors when in regards to breast cancer and so on. So can you talk to those 2 points, please?
Well, specifically, what about fruits? And did Tiffany had a specific question
Yeah, she
about
said
fruit?
what kind of health, well, fruits generally healthy fruits we can use for like when you're sick, you're having breast cancer, what kind of fruits you can
Yeah,
use. You talk all about antioxidants and so on early on. Can you elaborate on
right.
that?
So you want to, they say eat. Good question, Tiffany. First, let me say, good question. Thank you for that. Uh, you know, this what we say is to eat your colors. So when you're picking your fruits, and same thing with vegetables, you want to really focus on those kinds of fruits and vegetables that have a darker color. So your greens, right? Your purples, your reds, your oranges. So you you want to just have that color variation, and that keeps it simple, right? Obviously, you might have to take into account if you're allergic to certain things, then you might not be able to eat certain things. But I would say, as a general rule of thumb, eat your colors. So if you're making a fruit salad, you want to have all the colors in there, really varied up: red, green, yellow, orange, purple. And same thing with your greens and your vegetables. So that's the most simplest way I can put it,
Mm-hmm.
and just try to vary things as much as possible,
Possible.
because that then you'll have lots of antioxidants on board. And that's what we need. We need constant antioxidants on a regular basis in our body 24/7 to be working on those cells so that they're growing and developing healthy. And then that cells that are supposed to die, they die when they're supposed to, right? Because a lot of times, what causes the cascade of disease, not only cancer, but disease in general, or dis-ease, is that
I
we
like
have
that. This
cells.
is, yeah.
We just have cells in our body that they're just sitting around taking up space, but they're not doing much. They're old and they're just taking up space, and we now need to make room for the new cells. The longest cell in the body, which is the red blood cell, lasts for 90 to 120 days,
Mm-hmm.
right? And some of us, you might have cells that are older than that, and you have a lot of inflamed cells. That's where the joint pains come in, and all those different things. So you really want to have the antioxidants on board to make sure that your body is made up of healthy, vibrant cells
Cells.
that are ready to do what they need to do every single day,
Yes.
every minute of the day.
So can you talk about radiation as I asked before?
Yes. So when it comes to radiation, so radiation, it depends on the stage of the cancer, how aggressive it is as well, and there are different types of breast cancer, right? So that may be a form of treatment versus chemotherapy versus surgery, and sometimes you're using a combination of all three. And the idea, to put it real simple, is a lot more complicated than this, but I just like to kiss it. So, to keep things really simple, when we talk about radiation, it's like making the cancer cells so uncomfortable, forcing them to die,
Mm-hmm.
right? At a really high temperature, for example, right? So that's the idea behind radiation. Of course, now they're getting even more sophisticated with it, that because before, the same thing with chemotherapy as well, it would just blast everything, right? It would just attack everything. But now the treatments and modalities for cancer, they're getting to the point where it points certain things, pinpoints certain cells. Like it's only gonna attack particular, certain cancer cells. So it's getting even more, and as technology and research gets more advanced, we're gonna be able to refine that. But radiation, of course, like with any medication, has advantages
Mm-hmm.
and it has disadvantages. So what we have to now decide is, do the advantages outweigh the
Disadvantage.
disadvantage,
Okay.
right? And that's a discussion that you would have with your physician, and that's why they monitor certain things. They're monitoring, kidney function, liver function, other cell counts besides the cancer cells, your red blood cell, your white blood cell, because you want to see how the treatments are affecting your body. Is it the right dose? Is it not the right dose? And we have to like make adjustments there. And we also do know that radiation can, the presence of radiation or the history of radiation treatments can develop additional cancers later on. So this is why it's very important to have that discussion with your oncologist or with the person who's really managing your cancer, which most of the time it would be an oncologist, to determine which treatment modality
Should you
is
take?
best for you. Is it surgery, radiation, chemotherapy, a combination of both? So there are a lot of moving parts here, and that's why you definitely need input from a specialist. But keep in mind that there's also, we going back to the self-care. So despite what treatment modality is that you come up with your physician, and it should be a collaborative effort, right? Everything taken care of when it comes to your health should, and you're working with a medical provider, should be in a collaboration. It's something that both parties agree on, and we're working together, and there's trust involved. But you definitely have to have that collaboration. And we also really expect that you're going to be focusing on your self care as well
Mm-hmm.
whenever you're undergoing any sort of treatment. So again, you're taking care of your hydration, you're getting enough sleep, you're managing your stress level, you are exercising to your limits, or what kind of activity you've been cleared to participate in. You're focusing on your nutrition. So at the core, whatever health issue we're dealing with,
Self-care is
you
important.
have to have those self-care modalities regularly in place, and you have to make it a priority to really be conscious of the activities that we're involved in. And we cannot forget the spiritual side of things as well, right? That's
Mm-hmm.
a big part of healthcare, because we know, actually, I have a podcast. I don't know if I said this before, but I actually have a podcast. It's on Spotify. It's called Your Path to Wellness with Dr. Rhonda. So if you wanna, if you're not tired of my voice, you know, and fourth Sunday is not enough to hang out with me, and listen
You,
to my
you got
voice.
to tell the folks what time it is. What time you know what be on. You got to.
Yeah, no, so yeah, you can go to my podcast, and I have
Hmm.
like a lot of
Okay,
different
videos there. Yeah. Oh,
episodes
right.
of different topics and things of that nature. And I focus a lot on self-care, and one of the podcasts I talk about prayer and the health, the actual science. There's actual science and research behind the benefit of prayer. Prayer is a form of meditation, right? That's how I see it,
Hmm.
right? And so there's so many health benefits to having a spiritual groundedness that plays a huge role in healing. And we have to be able to tap into that as well. So we can't forget that that's a big part of taking care of our health in the holistic sense of the word. That spiritual food,
Okay. Well,
it's
Doc, we talk a lot about breast cancer, and we have two more topics to talk. We have about 20 minutes to go. Can you just give a final comment on that, and we just dive straight into menopause or next piece?
Yeah, I think always focus again on your health care, your self care, and find out if you haven't been screened in a while, or you've never been screened and you're at the age. Really try to focus on how to get the screening done. I think that's the best place to start.
Okay.
Self care and screening.
Good, good. Thank you so much for that. Now, Doc, we're talking about menopause. Let me ask a question. To me, it's a very important question. What is menopause? Can you break it down and then we go straight into that? What is menopause?
Well, I like to keep things really simple.
Simple.
So menopause is just a transition. It's just a transition from the reproductive years to the non-reproductive years. That's what it is for um for women.
Woman.
And the hormones, they start decreasing over time to the point where the hormonal levels are very low, and then the eggs are not released from the ovaries. And so when that happens, that reproduction doesn't take place at that point. The average age for women to go through menopause is in their 50s. In the United States, it's like 51,
Hmm.
but it can happen before that. 40s, late
30s,
mid to
late.
late 40s. Well, if it happens in the 30s, that would be considered early. But if it happens in like late 40s, yes,
Hmm.
that's consistent. But there's
Uh,
this whole period of perimenopause where
hmm.
you're not at menopause yet. But us women, we know you're not having your period every month. It may be every 2 months or every 3 months. If in that age close to menopause, then it might be coming. You might experience certain signs or symptoms. The signs and symptoms of menopause are so varied. Almost every organ system can be affected, but every woman is different. I know you mentioned before the hot flashes. So some women experience the hot flashes. Some women just feel tired all the time. They just have low energy. They're fatigued. Some women have problems sleeping. Some women have problems with their hair loss, or the hair is thinning, or the hair is very dry. The skin might be dry. Your mood can also take a hit as well. You might be depressed or anxious or irritable. You might gain weight. Some women gain weight um, because with those decrease in, and everything is driven by the decrease in the hormones,
Okay.
right? So some women gain weight because that decrease in the hormone leads to a decreased metabolism. So the way that we use calories is different. Some women have a reduced sex drive during menopause. They might experience discomfort during sexual activity because of vaginal dryness, because it's the hormones that help with the lubrication that's needed
Mm-hmm.
for sex to be very comfortable. So it it runs the gamut, the symptoms. Some people have joint pain. Some people have um increased inflammation. Some people start to develop high blood pressure, and there's an increased risk for cardiovascular disease as well in menopausal and postmenopausal women. So it affects each woman different.
Mm-hmm.
Some people have a very difficult time with it, and some people the transition is really
I,
just a smooth thing.
I, for the past 3 weeks, I spoke to two women in regards to this. And one of them told me that they're doing great, no problem at all, no problem at all. She's just doing fine, really good. And the other woman, she actually she's a nurse. She used to be a nurse. She's now retired. She told me that her house is wide open all the time, and I witnessed that for myself. The house is no curtain, big, beautiful house. I visited her recently there. The house is wide open all the time. All the windows are open. Only the
Are
door
you
is
saying
locked. And
heat
she's
because of the
always
hot
hot.
flashes?
She's always hot. Have to dress in. She unless she's outside. She'd always have to dress in something that is really thin and to help her with the heat and all this. What
Yeah,
can help? What can help? And she's a nurse, right? She used to be a nurse. What can help with these
you know what I'm gonna say, right? You guys know what I'm gonna say. What am I gonna say? What am I going to say?
ask one of the ladies to write it in the chat.
I want to hear from our
Let's talk to the
everybody
ladies in the chat.
right now. Come on, what is
Mm.
Dr. Karen Phillip gonna say? We should have some Jeopardy music. Dun, dun, dun. You know the Jeopardy song? But okay,
Say what you have
you
to say.
know, funny, but it goes back to all those principles of self-care. It really
Hmm.
goes back to that. You're hitting those things. You're hitting the sleep. I think it's like six things that we list, right? Your sleep, hydration, stress management, your spiritual health, nutrition, and exercise. Did I get
Hmm.
all of them?
Yeah, you
I
got
think
about
this
six
I
there.
think
You got
I'm
about six
about
there. You got
six,
about six.
right?
Yeah.
These because again, I know it's gonna be hard to believe, and sometimes when I talk to my patients and clients, they want like specific things. Okay, doc, what do I do for this? What do I do for that? What do I do for this?
They need
And
answers, doc. They need answers.
but the truth of the matter is
Hmm.
those six things, if we focus on those six things
Things would be
all
better.
the time, in general, it covers everything.
Right.
Right. So but say for example, so let me give some specifics, because I know, you know, we want some specifics. We want some
Mm-hmm.
specifics, right? So one thing that I think is really important to focus on, I'll pick two from the list. I'm gonna take all those six things are important. We have to focus on those six areas. Let's take exercise and nutrition
Mm-hmm.
as we want to focus on for to help make that transition smoother, because there is research, right, again, that exercise itself can decrease the hot flashes and a lot of the other symptoms as well. So I think finding an activity that identifies with you, that you love to do, that gives you joy, but also helps you work
Helps.
up a little sweat. And again, it's going to be different for everybody. Walking, jogging, dancing, yoga, chair exercise, Pilates. I don't know. It's going to be different. For swimming is a good one. I know in the Caribbean, I that's one thing I missed, and I do is I'm overdue for a trip back home, right? I'm overdue for a trip to Tobago and Trinidad for sure. And one thing I love is just the beauty of the beaches. I love that, and having that seawater, just riding the waves and having that seawater just
Awesome.
against you, you know, um, and just swimming. That's all body exercise. That's total exercise. Works everybody, every part of your body. So, I think exercise is going to be important. And then when it comes to the foods, again, you want to focus on foods that are natural, plant-based phytoestrogen. So they have like estrogen, certain plants have estrogen components.
Mm-hmm.
And remember, the issue with menopause is the decrease in particularly the estrogen level that's driving all of the symptoms. So you want to focus on your greens, and particularly broccoli and cauliflower. Those are great sources of phytoestrogens. Also chickpeas, your berries, your dark berries. And there's one particular herb. It's called black cohosh.
Mm-hmm.
There are some mixed reviews on this. I've read some studies that say, oh, it doesn't do anything, it doesn't work. And then I've read some studies that talked about the benefit of black cohosh in
Can you give me the
help
correct spelling? I put it in the chat box. Black. Okay, black.
black
B
B
L A C
L
K.
L A C K,
Mm-hmm.
one word, and then cohash, COHASH. Yes, cohash, black cohash. And then you also want to focus on your calcium and vitamin D and your B vitamins, your magnesium. Those will also help for hot flashes and also preserving the bone health,
Mm-hmm.
because post menopausal women also have issues with brittle bones, or the bones just becoming weak. So you really have to pay attention to your calcium and vitamin D intake there. I mentioned all the B vitamins, including your folate, your B12, your thiamine, your niacin, um, the magnesium we mentioned, the omega fatty acids. That's going to be really good. So that can come from healthy fats. So that comes from your deep cold water fish, like your salmon, your
Mm-hmm.
mackerel, things of that nature, avocado, nuts and legumes. Those are great sources of omega. your coconut oil, your extra virgin olive oil. These are good sources of omega, the healthy forms of fats. And you want to, flaxseed is also a good source of omega as well. So flaxseed, same thing like I was saying before, you want to kind of avoid processed foods as much as possible. Eat more of a clean diet, more whole foods, less refined sugars, refined carbs. So natural sugar is good, but the refined carb, anything with added sugar can be an issue. You want to avoid excessive alcohol intake. Now, alcohol can be very healthy in moderation, but you don't want it to be excessive. So yeah, again, if you are looking to ease that transition, starting with the self-care lifestyle modification, and some women, even after making these changes, and sometimes these changes will take a while for you to really feel the
To
effect.
kick
It's not
in.
like you
Okay.
exercise for 1 week and then, oh boom,
It's a
your
constant
menopause
thing.
hot flash is gone because you exercise for 1 week. It takes time. You have to build it into your life. So some women might still need small amounts of hormonal replacement, right? So it's a medication that you can take. You would discuss that with your gynecologist or your medical provider to find out if you are a good candidate for
Okay.
hormonal replacement if you're still having a difficult time. Um, but there are a lot of things that can mimic menopause. Not everything that we think is menopause is menopause.
Okay.
So sometimes some of the symptoms that I mentioned before could just be from overall stress. But the thyroid disorder, underactive thyroid specifically, can mimic menopause.
Menopause.
So it's important that if you are at the age, or for any reason you might have been pushed into menopause because some people have certain health issues where they had to have the ovaries or the uterus and or the
Removed.
ovaries removed.
Hmm.
Sometimes they just remove the uterus for certain health issues that you might have. Sometimes they remove the uterus and leave the ovaries. Sometimes they take everything out.
Hmm.
And so that produces a menopausal state. And sometimes those women, they would require um, some hormonal replacement.
Okay. Okay. Doc, well, we about say 10 minutes, and Amelia sent in a comment. I want you to just briefly talk about it and make her round off on this menopausal discussion.
Okay.
She's saying that,
Amelia,
yeah, Amelia, you're there. Amelia is saying, so our men need to be educated about how the female body operates, or else we have serious bedroom problems issues. I'm sure
well, listen,
I'm sure you heard about that already from some of your clients.
Amelia, that goes both ways, right? I'm equal opportunity, so it goes both ways. But yes, you are right. Our men need to understand us a little bit more, and we need to understand them too. Because men go through something similar. We'll talk about that during
And in June, right?
health month. We'll talk
Mm-hmm.
about that then. But men go through something similar, and sometimes we're looking at y'all and we're like, "What is wrong with him? What?"
Mm-hmm.
Like we don't understand that they go through something similar. And our men, when we're going through, they're looking at us like, "Is this woman crazy? This is not the woman I married. She's a total monster. What is happening?"
The effect
So
of menopause, right?
yeah, yes, it
Mm-hmm.
goes both ways. So
Good,
a lot
good.
of times we need some patience. We need some extra effort sometimes. I know Amelia was talking in the bedroom, but so the vaginal dryness can be a thing. It can be a significant issue, the decreased sex drive. And so sometimes you just need someone who's going to be a little bit understanding of,
Understanding?
and
Mm-hmm.
us for our women. Sometimes there's different things that we can do to help with the vaginal dryness. It's different lubricants, lubrication. You can work that into the relationship as well. And there's certain exercises that we can do that can help. The Kegel exercises for us women. If you've ever heard of the Kegel, what that is, I know we don't have time to get into that, but they're called Kegel exercises, Kegel, because sometimes with the decrease in hormones, you know, there's loss of elasticity in the vaginal area. So
Mm-hmm.
not only the dryness, but there's loss of elasticity, and then it just feels different. So that's where
Can it?
exercise in general will help with that, but
Mm-hmm.
particularly the Kegel exercise, Kegel, you know, right? Kegel, yeah, yep, spelled
Is
it
it
right.
an exercise that you can actually briefly show them there, or you can talk about?
It,
Can't.
it's not something to show. It's
Mm-hmm.
like it's a sensation for women. I really can't show
Okay.
it. It's like a feeling. You
Mm-hmm.
basically, and you can do it anywhere you are. You could be sitting, you could be standing, you could be lying down in your bed, but it's like you are basically squeezing the vaginal muscles. It's a certain sensation, but if you're not used to what it should feel like, it's kind of hard to explain, and it takes a little bit
Right. Right.
it will take a little bit more time.
Yeah.
So,
Okay.
but definitely for the sake of time,
Mm-hmm.
look that up. Kegel
Yeah. Don't let me
exercises.
say look it up. Yeah. 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 Yeah.
Yeah,
Can you give
because
me? Okay.
it's an
Good.
art.
I think
Uh,
this is great. That you shared a lot of information on that and in the pause, and I'm sure that the ladies here, they are taking some notes and getting themselves in gear. Doc, our mental health. Can you
yeah.
briefly talk about it? We have about 8 minutes. Can you briefly talk about
Well,
it and how
I
much is
mean,
affecting women nowadays?
it's a good segue because remember I said that some women who are going through menopause experience the mood swings, irritability, depression,
Mm-hmm.
anxiety. And then even to tie that in with breast cancer or any kind of health issue, if you're challenged with any kind of health issue, there's definitely emotion that comes into play there. It's a normal process, and just being a woman in general, we talked about this. There's certain things that we go through that sometimes is very hard to explain. Sometimes we're embarrassed to talk about it. Sometimes we don't even know how to talk about it because we may not even understand it ourselves. And as we just try to navigate life as a woman and wearing the many hats that we do, it's very easy to become overwhelmed. And I think it's important to just be taking inventory of you, inventory of your emotions. And this is positive and challenging emotions as well. But being able to tap into that and really identify what you're feeling. You might even need to identify certain triggers that kind of push us into different kinds of emotion.
Mm-hmm.
And then you have certain things that you do to kind of handle certain emotions. What does anxiety feel like? For example, that's an example. What does anxiety feel like? What does depression feel like? Most of us know what anger feels like. We know what sadness feels like. We know what happiness and joy feel like.
Mm-hmm.
But there's so many other emotions besides that we're not, maybe we're just not used
Used to or
to
connected.
validating. We're
Mm-hmm.
not used to validating.
Mm-hmm.
We're not right. We're not used to connecting it with what we're feeling in our bodies. And that's where having open forums like this and open discussions like this can really allow each one of us to explore those feelings as women,
Mm-hmm.
and I think it's important for us to start having those conversations in a different way and allowing ourselves to feel and put a name to certain things. And when you're not okay, it's okay to say,
You're
hey,
not okay.
not okay. Because we always, people ask, how are you? And I charge you that if you're gonna ask someone how they are, make sure that you're ready for the answer,
To
because not
respond,
everybody
right?
is gonna say, "Oh, I'm good," And sometimes we just say I'm good because we just
You
used
want to
to saying,
cover? It's a cover up, right?
yeah, but you're not
Not
good,
good.
and then it's okay to not be okay. It's
But
okay
deal
to
with it.
worry sometimes. Yeah, it's okay to worry
Mm-hmm.
sometimes. It's okay to be nervous. It's okay to be overthinking certain things, but allow yourself to feel that and then deal with
Deal
it.
with
And
it. Yeah.
sometimes we need help. And I know in our community sometimes there's a stigma against trying to access this help. It's okay for us to access prayer and spiritual help
Mm-hmm.
in that way. But sometimes you need an addition to that. Sometimes you do need a professional to talk to,
I,
and that's okay.
I,
And we need to have the permission that it's okay for us to do that.
a lot of people, doc, do not want to know, especially if you are quote unquote in a certain level of position in life. You do not want anyone to know. You actually come like this guy in the Bible who went to Jesus by night. You just don't want anybody to know, and you're dying on the inside.
Yeah.
There are lots of people like that. Well, of course, not we are talking about women, right?
Yeah, but yeah, there's a lot of people like that. There's definitely a lot of women like that. And I think it's just because, and I understand it because I wear two hats, right? So I'm what you would call first generation immigrant, right? So my parents are from Trinidad and Tobago. If you know me, you know that well. My mother's from Tobago. My father was born in Trinidad. So, but I was born in the United States and grew up here and had an experience
Mixed
of
culture,
growing
right?
up here. So it's like a mixed culture, and it I think it's shaped me in many ways because I can see both sides, right? I can see how difficult it is, culturally speaking, for us to access that type of help, and I understand why. But I understand the other side as well, and the benefits there. And sometimes there's a balance that we have to strike with giving ourselves permission. First, you have to give yourself permission, number one, but then we need people in our community to give us permission and not make us feel like, well, why you have to
Hmm.
go tell people about your problem? Why you have to, you only complaining all the time. Every time I call her, she only complain. Why she can't just pray about it like everybody else and just move on? We
Get it
all
over.
yeah, what's the big deal? We get a lot of that. And when it's because, but we understand why we get that. But now we just have to give ourselves the permission to say, no, it's okay if you're not okay. And it's okay to seek professional help. And we need the support from members in our community to help us do that and not make it feel like we're weak or we're
Hmm.
doing something wrong. Or I get this too. We're not a good Christian if you decide to go for help in that way. Seek out help in from a therapist or a psychiatrist or a counselor or you know something like that, because you don't want to air your dirty laundry, because a lot of us are dealing with trauma, stuff that happened to us when we were young that we didn't understand and we didn't process, and it starts to show up
Hmm.
when you're an adult in your relations with people, and not just romantic relationships but friendships, work relationships, just all kind of relationships begin to show up that way, and we don't understand why. So I think it's important for us to find a structured way to check in with ourselves.
Yeah, Donna May is saying therapy is very healthy, and also she's saying that in relation to the program tonight, she's having a blog on Tuesday night. We can check
I
that
was
out.
listening to
Let's
that.
see what
Yeah.
Donna May. For the longest while, I'm trying to have her on a program, but I don't know why she's hiding in the background. Well, Doc, it is so important.
She's hiding either.
I don't know. I don't know. I don't know. I don't know why she's hiding. I'm trying to get on the broadcast for the longest while. Maybe I don't know. Doc, you shared a lot of information tonight about cancer and menopause and mental health. Very valid information, valuable information, and I believe that our audience, or viewing audience from around the world, they have benefited from your information tonight, right? Do you have a closing comment to share with the world?
Well, first, I want to say thank you so much for this platform.
You're welcome.
Know there's a lot that goes into planning things like this. There's a lot of things that people don't see on the back end to make
It
these
happened.
things. I know it looks so effortless when we're
Mm-hmm,
under
mm-hmm,
when we're under
mm-hmm.
airways. We smooth about it.
Yeah,
We
with
have
a lot
a
of work on the
swag,
back end
right?
there.
We have a swag about it, but it's not so easy. It takes a lot of work, and I think hats off to you to just keep it going. I know what it's like. I know what it's like. So I just want to encourage you to keep this open, and because a lot of times this is the way a lot of us get our information, at least starts to the process of opening the mind, um, and the process of beginning to do a paradigm shift, like I call it, a mindset shift.
Mm-hmm.
And I think that's important because change is difficult, change is scary, but it is what it is.
That it is
And so,
important to make change.
yeah, but when you have platforms like this, it allows you to say, hey, I never thought about it like that way.
Mm-hmm.
Let me see, I wonder. And then you start doing your own little research and begin to, like, so much information is there.
Mm-hmm.
So I think it's amazing that we have platforms like this. And then what I love is that it's a platform for us by us. You
That's
can't get
right.
better than
That's
that.
right. That's right.
For
That's
us
right.
by us. Like, things that are important to us, conversations important to us. And I want to say, when it comes to health, my vision, when I think about health, is that, again, each of us think about health in that holistic sense of the word, and really try to make sure that our spiritual health is lining up with the other forms of health, our physical health, our social health, our emotional health and wellness. And I think if we start the process of that, oh my gosh, we'll be like just leaps and bounds ahead of where we were in general. Because the goal is always to be better so that we could be of service to others. We could use the time that God placed us on this earth for, you know, in in a way that's gratifying to him. But if we're not good, we cannot. And if we're not good all around, we can't be of service to God in the way that he is asking us to serve. We can't fulfill that divine purpose,
Mm-hmm.
you know? So That's why I think taking a look at health in this way is really a powerful thing. So thank you.
Well, Doc, we thank you so much for joining the program tonight. You know, it's a fourth Sunday night. Every fourth Sunday night, Dr. Rhonda Cambridge Phillip, she's on with us. We thank you again for taking out of your busy schedule, sitting here over an hour talking about cancer and menopause and health, you know, and so much information that was gleaned from what you said tonight. We thank you so much, you know, and this platform is always wide open to you. Folks out there in the virtual space, this is a platform that everyone would feel comfortable. So whenever you are on here, please share your comments, ask your question. Dr. Rhonda always say that she will be happy to answer your questions. We talk on the back end after coming off, right, Doc? We always talk, you know, and talk about the program. And the Bible says, whatever we eat or drink, we need to do everything to the glory of God. So we need to be careful of what we eat, we drink, we take our exercise, and do everything to glorify God. We love you. And God loves you best. And have a wonderful evening and take good care of yourself. By the way, tomorrow we'll be having a very important program. We normally do not broadcast on Monday night, but there's a special guest from Trinidad, and he will be directly in studio with me tomorrow night. You know, he's into big already. He's a holistic wellness person. It's a little different from Dr. Ron. By the way, Dr. Ron, you believe in holistic health, you know, herbs and things like that, you know. So we're having a medical doctor, and tomorrow we're having one who will be telling us about, he'll be talking about the guts a lot, right? So,
Yeah.
Doc, I wish if you can chime in on this program tomorrow, because I know this is a program that
Well,
you would really like to hear. Thank you again, everybody. God bless you. Have a fantastic evening and take good care of yourself and get some rest, according to Dr. Rhonda. Let's get to bed before 10 o'clock. God love you. We love you. And God loves you best. And those on YouTube, we thank you for joining. You know, I know the program went over an hour, but we just thank you so much. You can go back and please do not forget to share this program with a friend, share with your neighbor, your papa, your mama, your brother. Just share with everybody.